Hey everybody, thank you for joining us. My name is Celeste and I am one of the people behind the scenes here at Pesci Rehab. We are here to talk about our upcoming event in April. It's the Women's Health Summit. It's April 13th and 14th. Our speaker lineup is incredible. We've got 10 female clinicians that are giving actionable advice for several different diagnoses. And today I'm here with Cindi Lockhart, who's a registered dietitian. One of her sessions with us at this summit will be on autoimmunity. I know I'm not the only one, but I've got friends and family who have kind of been through the struggles of being diagnosed and know that these types of conditions are on the rise. But one of the things that's often hard for these patients is that it takes a really long time to get diagnosed. So from here, I'm going to let Cindi introduce herself. But my first question to kick us off today is, why does it take so long for women to get an autoimmune diagnosis?
Yeah, absolutely. So just talking about that, autoimmunity, as you mentioned, is on the rise. I mean, 1 out of every 5 Americans has autoimmunity, and up to 80% of them are women. And it can take 4.5 years and 5 different practitioners to finally get that diagnosis, which is frustrating because all you do is suffer until you can get that diagnosis and know, what do I do from here? And part of the reason is the symptoms are pretty vague. And so they really cross over to a lot of other health conditions, like your debilitating fatigue. You got joint pain and swelling. You have headaches. You have dizziness. You have rashes. You have GI disruption. You might have a low grade fever. And the symptoms come and go. So they're not necessarily persistent. And so you might think you just have a bug. And so then you step back and like, okay, I'm all right. And then they come back. So they relapse and they remit. And so one of the first line screens is an autoantibody called ANA. And so that's typically the first thing that would be tested if autoimmunity is suspected, but that can be delayed. So it might not show up positive, even
Yeah.
though there is an underlying autoimmune condition. And then it can also be a false positive. It can be elevated or positive because of an infection or because of certain medications. So it is frustrating to get that final diagnosis. But I think a lot of it is just trying to manage what you are experiencing and how can you optimize how you feel and how you function day to day in the meantime.
Yeah. So for our clinicians out there, when one of these clients presents and says, I've got these symptoms and nobody's listening to me, and I feel like I'm crazy because I've been dealing with them forever and all my labs come back normal, what's the first thing that somebody should be doing when that is the patient that presents?
And that, I would say, Celeste, is so common. I would say the majority of clients that come to me have that exact story. So I would say that there are 3 things that should happen: listen, assess, and personalize. And so really we have to start by listening. Try to map out the timeline. When did this start happening? Like, when did they start feeling bad? What were they experiencing? What could have been that potential trigger or triggers that set them off? And then let's do the assessment. So what labs were tested? Are there other labs that we can look at? There are the autoantibodies, but there's a lot of inflammatory markers, a lot of nutrients. The gut has a really big play in that. I know we're going to touch on that today. And so get that assessment, in regards to subjective, what are they feeling, objective, and then personalized. So we need to assess what their nutrition and lifestyle habits are as well. And so based on that and what we find out from the subjective and objective measurements, now we can start employing some tactics to help them at least feel better and function better until maybe there is a diagnosis. But still, even a diagnosis isn't their label or isn't their identity. We just really want to help people optimize how they're functioning long term.
And then this one, for me, is a big one, but obviously autoimmune responses are significant. Can it really just be as simple as foods we eat every day? Can simple modifications make a difference in the symptoms that these patients are experiencing?
Absolutely. Absolutely. There's actually several functional medicine practitioners who are true believers that you can reverse autoimmunity by just how you eat, what you eat. And so that is some of the things that we'll be talking about at the summit. But it really is what we're eating, how we're assimilating it. That again is going to come back to the gut. And then what are we exposed to in the environment? All of those things are going to play a role in autoimmunity, it actually showing up and the intensity of it and the progression of it.
Yeah. And then you teased us a little bit earlier, but microbiome right now is huge. I see it in everything. What are we learning about the impact of the microbiome and leaky gut on autoimmune disorders?
So you have to have three things present for autoimmunity to occur, and that's genetics, which we can't change. It's your gut dysfunction, so we'll talk about that, and then it's also some type of environmental trigger. So it is one of the three things that have to be in play for autoimmunity to occur. And so what we know is that up to 80% of our immune system is created in the gut. So that's huge, because this is an overactive immune response, right, when we have autoimmune conditions in regards to the microbiome and also leaky gut. So leaky gut, it's just kind of a term that makes it easier to visualize. We have to think about the intestinal barrier. It's in our small intestine. It's our gatekeeper. It's protecting us against the outside world, but it's one cell deep, so it's extremely fragile. So when it gets broken down, we breach the tight junctions, we make it more open or leaky. And so things that should not be getting into the body are. And that sets the immune system into play. So the immune system attacks, that creates a lot of inflammation, which is one of the underpinnings of autoimmunity. And then your microbiome, so your bacterial balance, is your big defense system, is protecting that fragile barrier. And so when that gets disrupted, which whose isn't, that is going to also affect the initiation and progression of autoimmunity.
Yeah. So then for our audience today, that's probably a mix of all kinds of people. We maybe have some rehab clinicians, we maybe got some mental health people, we maybe got some nurses. What is the one thing that you wish everybody knew about autoimmunity, inflammation, and gut health?
That you can prevent it, you can delay it, and you could potentially even reverse it. So it's really, I want to empower people, like no matter what specialty you're in, we can still listen. We can still guide. We can still help people function better. And that's what it's all about. You know, it's like, how do we optimize how we're living so that our risk and our progression of autoimmunity can be withheld, but also it affects all of our other chronic health conditions too. So we are in the driver's seat. You know, because genetics, when I mentioned that that's one of the three, is a very small component. It's only 30% of the equation. So we really do have the power to make changes in how we're living to change that journey and that trajectory.
Yeah. Lifestyle is medicine.
Yes.
Well, thank you for giving us a sneak peek into what your session will be at the upcoming summit next month. I hope that everybody is just as excited as we are. From there's a link down at the bottom if any of you are looking to expand your skill set for working with women. Click the link, take a look at this full schedule. Hope to see y'all there.